Go sit down at the little table, please. I was having significant amount of seizures, up to 10 a day, being severe grand mal seizures. I'd just drop to the floor, and sometimes I'd be in the kitchen cooking dinner, and it was just becoming such a problem. Yeah, something just has to be done.
Amy's a 35-year-old mother of two. I've known her since she was a teenager. Amy's seizures have always been really difficult to control.
Amy's pictures.
I knew when first I saw her that she had an abnormality on her MRI scan that was very large. We're trying to figure out exactly where the seizures come from. So tomorrow we'll make a hole in her skull, put a grid of electrodes on the surface of her brain and connect it to machinery to record her seizures constantly.
How are you guys?
And at the end of those few days, we'll make a decision about whether we can safely remove that area of brain. Then we'll go ahead with a separate operation, reopen the skull, remove the grid, take out that area of brain and put it back together again. So I'll draw you one of my great pictures. And here is where your seizures are coming from.
Okay.
Because that's the area which controls your face. So the seizures are starting there and spreading, and that's why we can see them in your face. So being able to understand exactly where the seizures come from and being able to remove that area safely is the key. We have got some of the best people employing some of the best and newest technology in the world on this project.
So this is the actual grid that we'll be using in the procedure tomorrow. And the idea is that we have a set of electrodes, and what we're really wanting to do is place these directly onto the surface of the brain in order to record as much of the activity related to the start of the seizure as possible to give us the best chance of figuring out how large and massive tissue the surgeon needs to remove.
This isn't routine, this is really special stuff. She really needs this to work.
Today's the big day. Get the grids in.
I think Amy's doing really well. She's really hopeful it'll all work out. She understands completely, I think, what it involves, how she'll feel and the risks involved. So I think she's in the best position she could be in.
Morning, Amy.
Morning, Michael.
How are you?
Yeah, good. How about yourself?
Not too bad, thanks. So you ready for today's surgery?
Yeah, ready
All right.
and willing.
So what we're going to do today is lift out the bone and open what's known as the dura. We locate the area from where the seizures appear to be coming, and then that will be the central point over which I lay the grid. Each time we do this, there is the sensation that you're going to be able to turn around a person's life. So what I'm doing now is lifting the bone off. So we just made a small incision in the dura, and you can see the underlying brain there. So this is the grid that we have. In Amy's case, the area of abnormality is extremely large. Being able to localise the area of seizure onset means that I am going to be definitely incorporating that into the grid area. The grid fits quite nicely. So what we've basically done is been able to cover where we think the source of Amy's seizures are arising from. That all went to plan. No matter what sort of brain surgery you do, there is always a risk. So you've got to be aware that simple things that you do every day, day in, day out, can still be very dangerous. Amy was essentially seizing for a significant proportion of that time, and hence we picked up a significant amount of seizures arising from the area that we thought. But 36 hours after Amy had the grid inserted, she had significant swelling on that side of the brain. Her conscious state started to fluctuate, and it was becoming more and more difficult to wake her. 36 hours after Amy had the grid inserted, she became very ill. If we didn't control that swelling, which required removal of the grid and the bone, she would not have survived.
It's been a rough trot over the last few days. I did have to take the bone out from the right side of my brain. Decided I'm going to shave my head. I think it's better that way.
It's been a bit scary, yeah. You know, a few complications, nothing that didn't go to plan. Does shake your confidence a little bit, yeah. She can go through this, she can go through anything, can't she? So it doesn't get much harder than that.
Amy had a complication on Friday night where we had to remove the grids, but fortunately we were able to mark out those areas. We can clearly see that they're starting at electrodes G19, G20. We know that these electrodes are the key for us from the point of view of removing the abnormal area. Hi Amy, how are you? Hi Simon, how are you?
How you going, Michael?
Good. So Amy, we were able to mark out where the seizures were coming from. So what we'll do tomorrow is that we will open up the scalp and we'll identify those areas and we will then remove those areas.
And then the bone back in.
Yeah, and the bone back in.
Don't forget the bone.
We won't be forgetting the bone, I can assure you.
I still have that worry that I'll be in recovery and all of a sudden I'll have a seizure. What I'm looking for, a more simple life and just not have the kids having to deal with seeing mum different to other mums. I want to just be a normal person. A lot more nerve-wracking than the first time. Well, I'm in the best of hands, so I can't ask for any more than that.
Today is where we're going to do the formal resection of the seizure focus from Amy. And we were just discussing the fact that there's a chance you may have a seizure during the operation and precautions we're going to take beforehand to prevent that happening. That's it, Amy. That was great. You did great. Okay.
Breath for me.
Just putting some local anaesthetic in now, Amy.
You want me to talk to you throughout? We can.
In Amy's case, awake surgery is very important because we know that when she has a seizure, very quickly her arm is involved. You okay there, Amy?
The line of sight you've got here?
With Amy awake, we're able to stimulate and minimise the chance of a complication. Obviously, it requires us to, at all times, communicate with Amy so she knows what's going on. Amy, you just need to be quiet for a second, please. The patient themselves, that can be quite terrifying. I have a special device, and if it is, for example, her hand or arm area, that will cause that particular hand or arm to move.
Are you doing that or is it... No? Okay, so I'm getting a bit of hand.
And that then tells me that that is an area that I'm not to go near. So that was hand moving.
Hand movement, yep.
So my biggest concern is that if we're not extremely careful, if we don't stimulate properly and accurately, then Amy can be left with essentially a stroke down the left side of her body. For a mother with 2 small children, that would be a disaster.
I wouldn't go through this twice.
You wouldn't go through it twice. Okay, she's getting facial twitching there now and hand tensing. Are you with us, Amy?
Yeah.
Okay, does it feel like you're having a seizure? Does that feel like it? Feels like she's towards having a seizure? How are you feeling there now? It's passing?
Yeah.
It's passing. Okay.
It's passing, is it?
Yes, it's passing.
Just wait 1 minute.
We'll just wait, yep, that's fine.
So what I've done here is I've burnt around the area that we're going to resect and then lift up that area that we believe the seizures are coming from.
So she's got normal finger flexion, but very limited finger extension now.
Can you do it a little bit?
Yep. Yes, she can.
Okay. So even though we don't appear to be in her hand area, just working immediately adjacent to it, she does immediately lose some of her finger movement. So you can see how precarious an operation this is. So obviously we don't want to go into that area. So that's as much as we can do with Amy, so we'll be stopping the resection here. I'm quite confident that we got the area that we aimed to remove. You obviously feel a degree of relief, particularly if the patient's all right.
Can I have a seat? Good to see you.
Good to see you too.
What's happening?
Not too much. It's been really good. I haven't had any seizures during the day.
So none at all during the day?
No.
That's pretty
I'm
good.
pretty happy with that.
You've adjusted to the haircut? It's the best part of my job, getting people through epilepsy surgery like this where it's impacted their life in this way. Can I have a look at your hand though?
Yeah.
Especially if you can see that it's really changed their life. I mean, that's just fantastic. And that makes everything worthwhile. So it was worth it.
It was definitely worth it.
Yeah. So being able to bring all of these things together at this point is really exciting.
Thanks, Heath.
Ames, pleasure. Great to see you so
Yeah.
well. We're doing something dramatic to them that's going to change their life.
I think it's amazing what they can do. I think it's everything, the technology, the staff.
We finally got there.
Exactly. Put it all together and it just is a masterpiece.
Okay.